Hello everyone, my name is Josh Adams. I'm a stroke nurse coordinator at Excella Health System along with my coworker Diane Dunn. We're here today to tell you a little bit about stroke signs and symptoms and what to do. First off, we want to tell you that there are two types of stroke. There are strokes that are caused by blockages in the blood vessels in the neck and brain that are called ischemic strokes. And there are also strokes that occur when there's bleeding in the brain. Those are known as hemorrhagic strokes. The ischemic type of stroke caused by blockage accounts for roughly 80% of the strokes that occur in the public. The hemorrhagic strokes are the other 20%. And the important thing to note is that stroke is a preventable disease. It's a very time-sensitive diagnosis. It is a critical care emergency. But there are things you can do and steps you can take to lower your risk of stroke and prevent a stroke from happening to you or your loved ones. First, I'll talk about the signs and symptoms of stroke that we want everyone to be aware of. And these can be remembered using the mnemonic Be Fast. The B in Be Fast stands for balance. If you notice that anyone is having a very sudden change in their balance, they're stumbling, they're finding it difficult to stand up, and this is a new change for them, this is a warning sign. The E in Be Fast stands for eyesight, and again, any type of sudden change in your vision or your eyesight is cause for concern for a stroke. The F stands for face, so someone has a facial droop that you notice, observe, or you feel yourself that part of your face is numb perhaps, or you're not smiling the way you normally do. That is a warning sign. A is for arm, so ask the individual to close their eyes and hold out both their arms, and if you notice that one is beginning to drift or maybe just falls to the bed or to the table, that is another warning sign. The S stands for speech. You can ask someone to repeat a simple sentence like, "The sky is blue in Greensburg, Pennsylvania," and assess their speech if they have trouble getting that sentence out, or if they just seem to not comprehend what you're saying. There's a lack of understanding there that we refer to as receptive aphasia. That is a warning sign. And then finally, the T in the Be Fast memory device stands for time. Any of these 5 symptoms, the balance, eyesight, facial droop, arm weakness, speech challenges or difficulty are cause for concern, and the time is to really emphasize that it's time to call 911. You need advanced medical care in this type of a situation. Formerly, up until recently, stroke was really thought of as a diagnosis that was more or less a cause of permanent disability or death in many people. And in fact, it is the leading cause of permanent disability in Americans. And depending on the source that you reference, it may be anywhere from the 3rd to the 5th leading cause of death in adult Americans. However, there are many timely interventions that can be performed that increase your chance of survival and increase your chance of recovery fully from a stroke. Here at Excella Health in Westmoreland County, we operate 3 hospitals: Westmoreland Hospital, Latrobe Hospital, and Frick Hospital in Greensburg, Latrobe, and Mount Pleasant. And all 3 of them are recognized by the PA Department of Health and the Joint Commission on Accreditation of Healthcare Organizations as primary stroke centers. What this means is that if you or someone you love is having a stroke, signs or symptoms of a stroke, it is of the utmost importance that you recognize this immediately and call 911. We encourage you, your friends, your family members to react to stroke symptoms rather than regret something that may have possibly been prevented or delayed. So we really encourage the public to utilize 911 in this situation. It's not a diagnosis that frequently gets better with time. It usually gets worse. So if you are of the mindset that, oh, I'm a little dizzy because I was out gardening and I came inside and I'm gonna lay down and put my feet up and see if it gets better and call my family doctor tomorrow, you really should be evaluated in an emergency department and call 911 to do so the paramedics can transport you. This offers the best chance of timely diagnostics and timely intervention, whether you're eligible for a clot buster drug that we use known as TPA, or perhaps a interventional radiology procedure where the clot can be retrieved. The utmost importance is that the signs and symptoms are recognized quickly and that you get help quickly. At Excella Health, we offer the full range of stroke care in our emergency departments, our radiologists, our critical care nurses, acute medical surgical nurses, rehabilitation therapy services, pharmacy. It's a multidisciplinary team effort that everyone is truly involved in and invested in making sure that patients have the best possible outcomes from their stroke, as well as geared with an eye towards prevention. So as we mentioned, the 80% ischemic strokes have preventable risk factors associated with them. Some of the biggest preventable risk factors that you should know about, that you should talk to your primary care or family doctor about, include having high blood pressure, having uncontrolled diabetes, smoking, and obesity, and also having a heart arrhythmia known as AFib can be a highly strong predictor of having a stroke. So if any of those conditions are something you or a loved one are being treated for, we encourage you to see your doctor regularly. Make sure that you are partnering with your family doctor to really control these risk factors that are controllable. The pandemic has brought new challenges to healthcare as a whole, we understand, as well as to stroke treatment. But the other point of emphasis here is that we really don't want anyone in the community to die of doubt or to hesitate to call 911 or come to one of our emergency departments if you're having stroke symptoms or any other type of medical emergency. We're here to serve and to treat you and hopefully restore that level of function to get you back on your feet and in the community.